Optic neuritis. Optic neuritis is the inflammation of the optic nerve. It mostly occurs in patients with multiple sclerosis. Here you can see the inflammation of the optic nerve. Classification of optic neuritis. Optic neuritis is classified on two bases, on the basis of ophthalmoscopy and on the basis of etiology. On the basis of ophthalmoscopy, it is of three types: retrobulbar neuritis, papillitis, and neuroretinitis. And on the basis of etiology, demyelinating infection, parainfectious, systemic autoimmune disease, intraocular infection. Let's first discuss on the basis of ophthalmoscopy. Retrobulbar neuritis. It's a condition in which the optic nerve is inflamed behind the eyeball, so the optic disc appear normal. Demyelination is common in this condition. It's the most frequent type seen in adults. It is frequently associated with multiple sclerosis. On fundus examination, no pathological changes seen. You can see here that the optic disc is not inflamed, margins are well defined, no hyperemia present. Papillitis is a condition in which the inflammation of the optic disc head occurs. It's a cause of the secondary optic atrophy. It's the most common type seen in children. On fundus examination, the disc is hyperemic with blurring of margin. Later, the disc becomes edematous. Engorged blood vessels and sphincter hemorrhages and fine exudate may be present. Here you can see that the normal optic disc is compared with the edematous optic disc. In the normal optic disc, no swelling present, well-defined margins are present, no hyperemia present. In the papillitis condition, swelling of the optic disc present, blurring of the margin, and hyperemia of the optic disc present. Neuroretinitis. It is a condition in which the papillitis with inflammation of the retinal nerve fiber layer occur. It's a rare type of neuritis. In this condition, macular star is present. Macular star is the exudate that form around the macula that gives the appearance of the star. On fundus examination, you can see that the swelling of the optic disc with blurring of the margin and hyperemia of the optic disc present. It's a condition that is seen in the papillitis as well. So the characteristic sign in neuroretinitis is the macular star that helps to differentiate the papillitis and neuroretinitis. Overall symptom: sudden unilateral loss of vision, bilateral loss of vision is present in viral disease. Pain is present when the patient moves his affected eye. Pain can be felt, and pain is more marked in patients with retrobulbar neuritis than papillitis. Sign: visual acuity is reduced, color vision is impaired, tenderness of the eyeball present, and the most important sign is the relative afferent pupillary defect, which is always present. Relative afferent pupillary defect is a condition in which the affected pupil dilate when light moves from normal eye to abnormal eye. Now let's discuss on the basis of etiology. Demyelinating disorder. It's a T-cell mediated autoimmune degenerative disorder. There is inflammation of the myelin sheath surrounding the nerve fibers in brain and spinal cord, followed by hardening of this affected area. When the myelin sheath is damaged, nerve impulse slow or even stop, causes neurological problem. Example includes multiple sclerosis and neuromyelitis optica. Here you can see the demyelination of the nerve that is caused by the multiple sclerosis. Infective cause of the optic neuritis include virus and bacteria. Virus is Bacillus zoster virus, and bacteria include those that cause syphilis, Lyme disease, cat's disease. Parainfective cause of optic neuritis include systemic viral infections such as measles and mumps and post-immunization. Investigation. The most common visual field defect seen is central scotoma in this condition. If the cause of the optic neuritis is multiple sclerosis, then the characteristic white matter lesions are always present in MRI. Serological tests are positive. Visual evoked potential is abnormal. Prognosis of the disease. Prognosis of the disease is good. Most people regain their normal vision within 12 months after optic neuritis episode. Treatment: Optic neuritis usually improves on its own, but in some cases, steroid medication decreases the inflammation of the optic nerve. That's all. Thank you.